I'm Kayla, and I'm here to talk to you today about CRPS, also known as Complex Regional Pain Syndrome. Complex Regional Pain Syndrome is defined as a disorder characterized by chronic disabling pain disproportionate to its inciting event. For example, this is when you get an injury and then you end up with chronic pain that's out of proportion. For example, your entire arm becoming inflamed. There are two different types. Type 1, in which you have no known nerve lesion. This corresponds to RSD, which is reflex sympathetic dystrophy, and can be initiated by periods of vasospasm or vasodilation. For example, you might get vasospasm if you have extreme edema or if you're wearing a cast that is too tight. You also might get vasodilation. Type 2 is when a nerve lesion is present. This corresponds to causalgia, which is a severe burning pain sensation. This has to do whenever you have a peripheral nerve injury. So what is the diagnostic criteria for CRPS? First, it's pain. You must have spontaneous pain beyond the territory of a single peripheral nerve, and it must be disproportionate to injury. What kind of injuries can lead to this disorder? A fracture, crushed limb, sprain, surgery, burns, or even an injection. Another diagnostic criteria is edema, or abnormal pseudomotor activity, which is abnormal sweating activity. These both must be present in the area of pain. You also must rule out all other diagnoses.
Hi, I'm Cassidy. For clinical diagnosis, symptoms are categorized. You must report one symptom in 3 of the 4 categories and display 1 sign during the exam in 2 of the 4 categories.
So first, you must have a symptom in the sensory category. Sensory reports include hyperesthesia, which is increased sensitivity, which leads to increased pain, and or allodynia, which is when something that's not supposed to cause pain causes pain. For example, simply just brushing your arm could cause excruciating pain. You also have vasomotor changes. For example, temperature asymmetry, where one arm feels warm and one arm feels cold, and or skin color changes. You can also have reports of edema or sweating changes, or sweating asymmetry, where one area is sweating and one area is not. And then you also have the motor trophic area, in which you have reports of decreased range of motion, or you could have muscle weakness, tremors, dystonia, and or trophic changes in the hair, nail, or skin.
For diagnosing someone with CRPS, you have to rule out Lyme disease and peripheral neuropathy.
Hi, I'm Cara. Patients experience pain in a variety of different ways, such as deep burning, tearing, and stinging. The latest research indicates 60% of people diagnosed with CRPS experience pain during movement. Over 50% experience pain when the limb is orthostatic position. For example, patients may experience pain in the arm or hand when the arm is in the person's side during standing. 55% of patients with CRPS type 1 and 76% of patients with CRPS type 2 experience spontaneous pain.
Pain, edema, and other symptoms occur distally from the affected limb in a glove-like manner and may spread to other limbs.
There are several other problems people with CRPS may experience. For example, they may experience mental health problems, especially due to the intensity of the pain that could lead to depression or anxiety. CRPS may also experience a neglect-like phenomena. This is where you feel that the injured part of your body is not actually a part of you. It feels foreign, and then you may tend to neglect it because of this. People with CRPS may also experience contractures or abnormal positioning or posturing.
Hey Cara, have you ever heard about the prevalence of CRPS?
Hey! Yeah, I have. Do you want to share with our friends?
Yeah.
Around 26.2 out of every 100,000 people are affected each year.
It's most common in those between the ages of 61 and 70.
Occurs 3 times as more likely in women than in men.
Patients are more likely to experience symptoms in the upper extremity rather than the lower extremity.
Those experiencing menopause, migraines, osteoporosis, asthma with angiotensin-converting enzyme inhibitor therapy, or elevated in-contrast pressure are at more increased risk for CRPS.
CRPS occurs in stages. Cara, do you want to tell us about it?
Sure. Stage 1 is the traumatic stage. It's about the first 3 months. There's pain, edema, and discoloration.
Stage 2 is the dystrophic stage. Patients in this stage experience pain, brawny, muscle stiffness, warm, red skin, edema, and bony demineralization. This stage occurs from 6 to 9 months.
Stage 3 is the atrophic stage. It occurs 3 years to indefinitely. Symptoms present as thick joints, slight decrease in pain, edema, which is responsive to normal treatment, and affected extremity is dysfunctional.
So what does this have to do with occupational therapy, you ask? Hello, I'm Peyton. So, CRPS affects a large number of ADLs and IADLs. Exacerbating pain factors include movement, cutaneous stimulation, and stress. This means performing functional tasks such as eating, sleeping, dressing, toileting, can cause extreme pain during surface contact or movement. There are some signs to look for when working with your clients that may tell you that they're suffering with CRPS. For example, your client may have a desire to keep their arm cradled. Other signs are as they want to keep it wrapped up. Be aware that this could be a sign of guarding. Also, clients may be especially sensitive to light touch. Treatment for CRPS is symptomatic. Important roles of OT include edema management, progressing active range of motion to tolerance, while being careful not to flare symptoms, and encouraging aerobic exercise to improve circulation. PAMs can be used, along with treatment, before active range of motion to prepare your client and decrease pain. For example, Cara's getting her TENS treatment right now. Patients with CRPS often receive OT, PT, psychotherapy, pharmacology, recreational therapy, and vocational therapy. Because CRPS can develop postoperatively, it is important to watch for signs such as prolonged, disproportionate pain and abnormal, persistent edema. It's important as OTs that we normalize sensation, reduce edema, increase mobility, strength, and endurance, decrease guarding, and restore routine activities for our clients. As OTs, it's our job to educate our patients on their diagnosis. Home exercise programs are beneficial for patients diagnosed with CRPS. They vary depending specifically on the individual. Initially, home exercise programs focus on scrubbing or weight loading and desensitization techniques to begin actively engaging muscles in the affected area and help with pain management. After the initial phase, home exercise programs can be upgraded to focus on increasing range of motion and strength. Home exercise programs include functional activities based on ADLs that are currently difficult. For example, drinking from a cup with the affected hand, or wearing a shoe on the affected foot. Functional activities can be done throughout the day for short periods of time to incorporate the affected area back into the routine. It is important to inform your client on environmental adjustments that can be made. For example, avoiding congested areas. Adaptations can be made to clothing to avoid the affected area in case it's too sensitive.
So I have this quarter zip here, which you have to pull over your head and put your arms through. So let's try that first, okay?
Okay.
Is that too much?
Yeah, I don't like
Okay.
that.
Let's try something else. So let's try your coat. So we can put this around you and you can just drape it around your arm, okay?
Okay.
And then let's just drape it.
That's much better.
Good.
Depending on your client's needs, you can also educate them on adaptive equipment to be used so that they can still participate in their daily occupations. So I hear you're having trouble riding at school.
Yeah.
Let's talk about some options for you.
Now let's talk about some CRPS interventions. Desensitization techniques come in many forms. Desensitization techniques can be used to decrease hypersensitivity to cutaneous stimuli. Various textures of fabrics can be presented to the area, progressing from least noxious to most noxious and consistent to intermittent application to improve tolerance to light touch or pressure. So we have a little bit of example. So with our patient, we can start with something like a cotton ball, super soft, fluffy, and we will lightly graze her arm where she has CRPS. And then you can always grade it up to something like a cotton swab, and then something like a toothbrush with soft bristles, and eventually something like a hairbrush with thicker bristles. And then you can do a variety of different fabrics as well. So right now I have a towel. And then of course this would happen over a long period of time. So this can take several weeks to complete, and this does not conclude that the fabrics will feel good. So this is kind of saying that like eventually she will just be able to tolerate the feeling. It's not going to be a pleasant feel. It may always have a little bit of hurt behind it. And not necessarily feel good. Desensitization typically enables a stimulus to be tolerated for longer periods with a lower pain response. There are two different types of desensitization techniques. The first one is scrubbing. So applies a constant form of desensitization through the affected area. For example, the upper extremity can be used with a towel or a scrub bus, just like Cassidy's doing. A lower extremity could be a sock or a scrub brush. The object is rubbed in both directions, back and forth, across the area with constant pressure. Initial protocol is 3-minute treatments and up to 3 times a day. To grade this activity, you would increase in duration and frequency, and you could even apply more weight through your arm so she can push harder. Carrying is another type of desensitization. It involves carrying a weighted object for an increased duration of time to apply loading to the affected extremity. An upper extremity exercise can be something like carrying a box. Or the lower extremity can be just simply walking and adding weight shift through each foot. Graded motor imagery is another technique to use. GMI is the process of training and retraining your brain for connections. It's broken down into 3 stages. The first is left-right discrimination. Research shows that people with chronic pain often have trouble differentiating between left and right. So the process of identifying one side of the body as distinct from the other. The second is explicit motor imagery. It is thinking about moving without actually moving. So this is an example when athletes pretend they're doing the activity before they're actually doing it. This can also be explained as why you feel tired after an action movie, because the mirror neurons in our brain think we're doing the action when we really aren't. Third is mirror therapy. So this is using visual feedback of a mirrored limb, trunk, or face to alleviate limb pain. This creates the illusion that the affected body part is moving pain-free. So if this was my hand and my mirror was right here, I would look into the mirror and it looks like it's this hand. At first, I would just look through the mirror, and then eventually to grade the activity, I would add movements. It is hypothesized that this therapy could systematically activate cortical areas, leading to cortical reorganization and reduced pain.
Another intervention is a peripheral nerve block. This provides temporal pain relief. It blocks the pain which is caused by the nerve imagery. Sometimes it interrupts the sympathetic response. Essentially, it makes it so things that normally cause pain will no longer cause as much pain anymore. It's injected from a local anesthetic. For example, for the arm, the anesthetic would go into the brachial plexus. Edema management can also be used, such as movement, elevation, massage, and compression. Lastly, range of motion is a good intervention. Active range of motion is crucial for treatment, and you could use a gravity-limited plane to decrease the pain elicited during the treatment. Any intervention that increases pain, such as passive range of motion, should be avoided. Moving the limb can promote and increase blood flow, increase flexibility, strength, and function of the limb, and aerobic exercise can improve circulation. There are some emerging interventions for CRPS. One of them is IVIG, which is intravenous immunoglobulin. This is used for individuals who do not respond well to other treatments. There has been seen a greater decrease in pain scores with individuals who receive the saline. Another one is ketamine, which is a strong anesthetic given intravenously. This reduces or sometimes eliminates the chronic pain from CRPS. There is also graded motor imagery, which has been talked about previously.
In summary, CRPS is a group of disorders involving pain and dysfunction of severity or duration out of proportion to its initial event.
Symptoms include pain, edema, sweating, and blotchy, shiny skin. CRPS can develop post-operatively or through a systemic disease.
Watch for signs such as prolonged disproportionate pain or abnormal persistent edema. Treat symptomatically, but be cautious to not flare symptoms.
Thanks for joining us today and learning about complex regional pain syndrome.
Bye!
I worry about nothing.